Our next speaker is going to be Ayazi, and he's going to present day-to-day discrepancy in Bravo capsule pH monitoring, the impact on manometric placement, and status of the lower esophageal sphincter. The green arrow, yeah.
Good afternoon, ladies and gentlemen. The Bravo pH capsule is a wireless monitoring system that causes less patient discomfort and therefore allows longer duration of recording of esophageal acid exposure, usually 2 or more days. Previous studies have reported a discrepancy between day 1 and day 2 of this monitoring in up to 1/3 of the patients. The most common method of placement of this capsule is following endoscopy, and this technique and the sedation used during it has been proposed as an explanation for higher degree of acid exposure during the first day, and therefore a discrepancy between day 1 and day 2 results. An alternative method of placement of the capsule is transnasal placement with no sedation and based on the manometric measurements. The aims of our study are first to assess the discrepancy in acid exposure measured on day 1 and day 2 after transnasal placement of the capsule with no sedation. And second, to determine factors associated with this discrepancy. A total of 475 patients underwent Bravo pH monitoring for assessment of their reflux symptoms. Patients were excluded if they had a previous foregut surgery, if they had their capsule placed after endoscopy, and if they had monitoring on acid suppression. After excluding these patients, we ended up with 310 patients as the final study population. 51% of them were male, and the median age was 52 years. Overall, there was a good correlation between day 1 and day 2 acid exposure, whether this was assessed by percentage total time or by looking at the composite pH score. However, when we look at the composite pH score of each individual patient, we found some discrepancy. In 81% of the patients, there was no discrepancy between day 1 and day 2. In 41%, the score was normal on both days. And in 40%, the score was abnormal on both days. However, in 19%, the score was normal on only one day. Day 1 was the abnormal day in 45% of the patients of this group with discrepancy, and day 2 was the abnormal day on the remaining 55%. In this result, you can see the comparison of the different components of esophageal pH monitoring and the composite pH score for the worst day of monitoring between the patients who had an abnormal score on only one day and those with an abnormal score on both days. The values were all significantly higher for the group with abnormal score on both days. Of note, the composite score on the group with abnormal score on both days was twice as the group with abnormal score on only one day. We also look at the resting characteristic of the lower esophageal sphincter across the groups by moving from the patients who had a normal score on both days to those with abnormal score on only one day, and toward the other group with abnormal score on both days. There was a significant decrease on overall and abdominal length, as well as the resting pressure of the lower esophageal sphincter. In addition to looking at the different components of the sphincter, we also look at the prevalence of a defective valve in these three groups, again, by moving from the group with normal composite pH score on both days to those with abnormal score on only one day, and those with an abnormal score on both days, there was a significant stepwise increase in the prevalence of a defective valve. In summary, there is a discrepancy between the result of day 1 and day 2 in 90% of the patients who had transnasal placement of capsule without sedation. This rate is slightly lower than the series which had the capsule placed via endoscopy. Factors associated with the discrepancy in our study were severity of reflux disease and the competence of lower esophageal sphincter. And in conclusion, variability in the results between day 1 and day 2 of Bravo pH monitoring represents early deterioration of the gastroesophageal barrier and indicates a less advanced form of reflux disease. Thank you.